Thank you for staying with us. The World News at 6 begins in the health sector, where stakeholders have called for a sensitization to erode the stigma surrounding cases of infertility. The medical director and chief executive officer of Clearview Hospitals and Fertility Clinic, Lekki, Dr. Ajayi, who spoke to journalists during a 6th anniversary celebration and clinic tour today, tagged Celebrating a Legacy of Trust, also urged the federal government to consider a reduction or total erosion of tax on medical equipment and consumables to ease and enhance health services to citizens. Speaking further, he urged Nigerians to beware of fraudulent fertility clinics and practices, even as he lamented the constant migration of qualified medical practitioners to other climes. He urged couples seeking fertility treatments in Nigeria to opt for solutions within the country, as, in his words, there is nothing obtainable outside that Nigeria does not offer right now. Let's take a listen to Dr. Ajayi of Clearview Fertility Clinic speaking today.
Ajayi. I'm a consultant, obstetrician and gynecologist, and a reproductive medicine expert. I am the medical director of Clearview Hospital and Fertility Clinics. So we offer obstetrics and gynecology services, so we treat women basically, but we also treat children, So as part of our services, we do things like gynecological surgeries. We do keyhole surgeries, laparoscopy, and hysteroscopy, and other things. We also offer fertility services, and it's from basic fertility up to the level of IVF. So then, of course, we have pediatric services, But the reason for this celebration is, it's our 6th year, and we are celebrating a legacy of trust. Trusts from our patients, trust from our clients, trust from people that refer patients to us, even trust from our competitors, because it's been, not Nigerian, the Nigerian environment is such that if you are not resilient and if you're not doing the right thing, most likely you'll be pushed out within the first year. But we've gotten to 6 years, and we're not just thriving, we're actually growing to provide more services. As you can see, where we are now is a new facility, a new branch, Clearview Hospital and Fertility. So in a typical year, we are doing close to 200 cycles now. 200 cycles means every month we are doing close to 20, cycles. And in a year, our typical success rates can vary between 40 and 60%, depending on what we do. And it's something I'm very, very proud to discuss, And as at today, by the number of babies, I'm sure we don't have less than 300 babies now.
In his submission, consultant embryologist Olajide Wilson spoke on the preservation of fertility, eggs, embryos, and ovarian tissues, which can be used in later years for in vitro fertilization, IVF. Let's take a listen to him.
My name is Olajide Wilson. I'm an embryologist with over 15 years work experience in the IVF industry. So when you're talking about preservation of fertility, which includes preservation of eggs, preservations of embryos, and preservation of sperm, even ovarian tissue. So if you ask, can a woman preserve their fertility? Yes, they can. So what happens is they are going to go through the normal IVF route, whereby they are stimulated to produce eggs, and after the eggs has been produced, they are cryopreserved, that is, they are frozen. And for men, maybe for one reason, the person is having cancer treatment before the procedure starts, they can actually preserve, store the sperm and keep away before the treatment of radiation or chemotherapy starts, which eventually will affect their, which will actually affect the male fertility organ. The same way also for women. You know that immediately they are crossing 35 years, they rapidly lose their fertility status starts decreasing rapidly. So it is also advisable when you're approaching 30, when you cross the mark of 30, and you are actually probably a career person, or you've not gotten the right person, you can cryopreserve your eggs, which you can use subsequently at 40 or above, when your eggs might not be that viable again. So you can actually go back to the frozen eggs and use them for true IVF procedures to achieve pregnancy.
On her part, human resources consultant and life coach Mrs. Adekbeju Adegoke applauded the clinic's achievement in staff development in the past 6 years, as the establishment had sent its heads of department on a leadership course outside the country recently. Meanwhile, the United States